Have you ever wondered how our bodies, especially the hormonal imbalances in women, could be linked to heart disease? This is not a question that arises in everyday conversation, yet it's one that could potentially affect millions of women worldwide. Consider this. Polycystic Ovary Syndrome, or PCOS, a condition characterized by hormonal imbalances, irregular periods and weight gain, affects between 6 and 12% of women in the United States. Dysmenorrhea, on the other hand, is a condition that causes severe period cramps and can be a symptom of underlying conditions like endometriosis or uterine fibroids. It affects an astonishing 16 to 91% of individuals with ovaries. These conditions are not only distressing in their own right, but recent studies suggest they might also increase the risk of heart disease. Women with dysmenorrhea, for example, are more likely to have chronic ischemic heart disease, while women with PCOS have a 30% higher risk of high blood pressure. So, let's dive into the research that's sparking a new wave of understanding about these conditions and heart disease. Two separate studies presented at the American Heart Association's scientific sessions have shed some light on this subject. From these studies, we find that women experiencing dysmenorrhea or severe period cramps show an increased likelihood of developing chronic ischemic heart disease. Now, chronic ischemic heart disease might sound like a mouthful, but it's simply a condition where the heart muscle doesn't get enough blood due to narrowed or blocked arteries. The studies also highlighted that women with Polycystic Ovary Syndrome, or PCOS, are presented with a 30% higher risk of high blood pressure. To put it simply, PCOS is a hormonal disorder common among women of reproductive age, and high blood pressure, also known as hypertension, is when the force of blood against the artery walls is consistently too high. These findings are significant because they connect disorders that were previously considered unrelated. It's like discovering a hidden bridge between two islands that we've always viewed as distinct and separate. However, we must remember that these are associative findings. This means that while there is a notable connection between these conditions, it does not necessarily imply a cause and effect relationship. As an analogy, think of it as noticing that people who own dogs tend to be happier. Owning a dog doesn't cause happiness, but there is a clear correlation between the two. While these associations are intriguing, the exact mechanisms behind them are still shrouded in mystery. The fascinating thing about science is that every answer opens the door to more questions, and every discovery is a stepping stone to the next. So, as we unravel these connections, we inch closer to a better understanding of our bodies and health. Inflammation and stress, two elements that seem to be a part of our daily lives, are believed to play a significant role in this connection. Let's delve a little deeper into this. Inflammation is our body's natural response to injury or infection. However, chronic inflammation, which persists for weeks, months, or even years, can lead to a variety of health problems, including heart disease. In women with conditions like PCOS and dysmenorrhea, chronic inflammation is often a common symptom. This could be one of the reasons why these women have a higher risk of developing heart disease. Now, let's talk about stress. It's a feeling we're all too familiar with, but did you know that chronic stress can also increase inflammation in the body? In addition, stress can lead to high blood pressure and other heart disease risk factors. So it's not hard to see how stress might play a role in the link between menstruation disorders and heart disease. Interestingly, our lifestyle choices can have a significant impact on both inflammation and stress levels. For instance, a balanced diet, rich in anti-inflammatory foods, can help reduce inflammation. Regular physical activity can also lower inflammation levels and help manage stress. Furthermore, adequate sleep is crucial for stress management and overall health. However, it's important to remember that while lifestyle factors can influence inflammation and stress, they don't tell the whole story. Genetic factors, hormonal imbalances, and other health conditions can also contribute to these disorders and the associated risk of heart disease. So is there a way to potentially reduce the risk of heart disease in women suffering from these conditions? Yes, there might be. And it starts with making some changes in our daily lives. The power to reduce the risk of cardiovascular disease and ease symptoms of PCOS and dysmenorrhea may lie in our daily routines. The modifications we're talking about are not revolutionary, but they are fundamental. They revolve around three main pillars: exercise, sleep, and diet. Let's start with exercise. Regular physical activity is a powerful tool for overall health. It not only helps maintain a healthy weight, but also aids in regulating hormonal imbalances, a common issue in conditions like PCOS. Exercise has also been proven to improve blood pressure and reduce inflammation, both of which are critical in preventing heart disease. The best part? You don't have to run a marathon. Just 30 minutes of moderate intensity exercise 5 days a week can make a world of difference. Next up is sleep. Often overlooked, a good night's sleep is essential for our bodies to rejuvenate and repair. It helps balance our hormones, manage stress, and even reduce inflammation. Aim for 7 to 9 hours of sleep per night. If you're struggling with sleep, consider incorporating relaxation techniques such as meditation or deep breathing exercises before bed. Last, but certainly not least, is diet. A balanced diet is key to managing weight, regulating hormones, and maintaining heart health. Focus on whole foods like fruits, vegetables, lean proteins, and whole grains. Limit processed foods, particularly those high in sugar and unhealthy fats. And remember, it's not about dieting, but rather making sustainable changes to your eating habits. These lifestyle modifications may seem simple, but their impact can be profound. They can help manage symptoms, reduce the risk of cardiovascular disease, and promote overall well-being. But what about medical treatments? Is there anything available specifically for these conditions? Unfortunately, there are currently no approved medications specifically for treating PCOS. But that doesn't mean we're helpless. It's often said that knowledge is power, and in this case, it's the power to take proactive steps towards better health. Regular checkups are of utmost importance. They provide a platform for us to keep tabs on our health and catch potential issues early on. For women with PCOS or dysmenorrhea, monitoring blood pressure and weight can be particularly crucial. These two factors can serve as indicators of cardiovascular health and provide a clearer picture of what's happening inside your body. But it's not just about getting the numbers, it's about understanding what they mean and how they relate to your overall health. High blood pressure, for instance, is a known risk factor for heart disease, and maintaining a healthy weight can help manage hormonal imbalances associated with conditions like PCOS. Of course, these checkups and self-monitoring should go hand in hand with open conversations with your healthcare provider. Your doctor can provide personalized advice and treatment options based on your unique health profile. They can guide you through the labyrinth of medical information and help you make informed decisions about your health. Remember, the goal isn't just to treat symptoms or manage conditions, it's to enhance your quality of life. And that often involves making proactive decisions about your health, whether it's adopting a healthier lifestyle, seeking medical advice, or staying vigilant about changes in your body. In the end, every step we take towards understanding our bodies and taking care of them can make a significant difference. Let's strive for a healthier tomorrow today.